Hello, my name is Vishal Venkat Raman, and I would like to present a remote prehabilitation program we have been running at the Royal Marsden Hospital and the impact this has had on outcomes following major cancer surgery. At the start of the COVID-19 pandemic, we had to suspend our normal prehabilitation service. However, it quickly became clear that the restrictions brought on by the pandemic would be with us for a while. And so it was important to find a way to deliver multidisciplinary therapy to our cancer patients, many of whom are vulnerable and in need of input. So we adapted our prehabilitation service so that it could be delivered remotely in a safe way with the use of virtual consultations and web-based resources such as online exercise classes. Our program is for patients from two tumor groups, upper GI and gynecological cancers. It runs over 8 to 12 weeks while patients are having preoperative neoadjuvant chemotherapy, and there are four main pillars: physiotherapy, perioperative anesthesia, dietetics, and psychology. We sought to investigate what impact remote rehabilitation has had on two surgical outcomes. Firstly, the serious surgical complication rate, which we defined as the percentage of patients suffering from a Clavien Dindo grade 3 to 5 complication. And secondly, the median postoperative hospital length of stay. And for the upper GI tumor group, we also included the median postoperative intensive care length of stay. We reviewed surgical outcomes from the first 12 months of patients completing the remote rehabilitation program, for which we had 55 patients. Our control group for comparison was a 12-month period before the introduction of a formal rehabilitation program, for which there were 88 patients. And patients in both groups had similar demographic variables and cancer treatment pathways. We found an improvement in the surgical complication rate in the cohort that received remote rehabilitation. The complication rate in the prehab group was 14.5% compared to 18% in the control group. And as you can see from the table, the median postoperative hospital length of stay in those who had remote rehabilitation also improved for both tumor groups. And so did the median postoperative intensive care length of stay for the upper GI tumor group. Our experience over the last year is that remote rehabilitation can be delivered safely and successfully to patients. The improvement we have seen in the surgical complication rate and in the hospital length of stay is a promising sign of the beneficial impact this may have had on patient care.